This video could save your life. Imagine you wake up one morning, you go for a checkup, and you find out that you have prostate cancer and that it has spread. Sound impossible? No. That's the way the majority of men learn that they have prostate cancer, is when it's already advanced. So in under 10 minutes, I'm going to give you 7 signs and symptoms to watch for. These are your early warning signs that your prostate could be in trouble. And I'm going to also tell you what you can start doing immediately to change that. Here's the hard truth. When prostate cancer is found early, the 5-year survival rate is literally 100%. But like I mentioned, unfortunately, men don't catch it early, commonly. And that's because these early changes are very subtle. A little bit of a weaker stream. You're waking up in the night to go to the bathroom. I'm going to count down each of these signs from number 7 through to number 1. Number 1 being the most critical red flag. For each, I'm going to explain what it is, what it means, and the steps you can take right away to be sure this doesn't happen to you. Sign number 7, recurrent urinary tract infections. I see a lot in my practice that men can carry urinary tract infections long term and not even realize they have it. And that's because the bladder is so far away from the opening that the urine comes through. The penis is where that urethra is. That's the name of the tube that runs from your bladder outside. And it's longer, whereas we women, we have these teeny short little urethras, and so if we get any bacteria in the urethra, immediately the bladder is infected, and we know that. One thing I look for in practice is if your sexual partner keeps getting UTIs. If the woman has chronic UTIs and the guy is like, well, nothing happens to me, you may be carrying it. You guys may be reinfecting each other, so y'all should both be treated at the same time. Sign number 6 is a weak or interrupted urine flow. If you are going to the bathroom and urinating, you should have a strong flow that lasts all the way through until your bladder is empty. If you start and stop, you urinate, but you feel like, there's still something there, and you urinate a little bit more, that could be because that prostate is swollen and impinging on the urethra and not allowing you to urinate fully. Sign number 5 is waking up too many times in the night to go to the bathroom. Now, what's too many times? An occasional once a night is normal. If it's chronic once a night, now it's getting to be twice a night, sometimes it's 3 times a night, that's not normal. And it's common, right? So you may hear, well, you're just getting older. But just because it's common doesn't mean it's normal. Sign number 4 is if you have a little bit of blood in your urine or in your semen. Blood can be difficult to see with the naked eye when it shows up in the urine, but watch for a pink tint to the urine or the semen. Sign number 3 would be persistent pain in your back, your hips, and your pelvis. If you have this chronic pain, then that can be a sign that that prostate is swollen. It's causing inflammation throughout the region and should be looked into. Sign number 2 is erectile dysfunction. Now, before you jump to it, not all erectile dysfunction means that your prostate is having trouble. This would be more a sudden onset erectile dysfunction, whether it's attaining an erection or maintaining an erection. If you have more suddenly experienced this problem, then that could be a warning sign that your prostate needs to be checked. And then number 1 is when pelvic, back, groin pain lasts for longer than 2 weeks. Not only is it just coming and going, but it's lasted long term and it has not let up. So if this video even raised one question in your mind about the health of your prostate, it's important that you write down all your symptoms, go get an exam, and don't take no for an answer. So what do you do if you have some of these symptoms? The common denominator is bacteria and fungal overgrowth that doesn't belong there, infecting the prostate, causing that inflammation, and then leading down the road to the abnormal cells that develop into cancer. So the important thing is to keep your body free of bacteria and fungus. Number 1, drink water. You must have at least 2 liters of water every day to flush your urinary tract. And you can use cranberry capsules. You can use a product called D-mannose. Take a good probiotic. They do make probiotics more specifically for men's health. Your local health food store, Sprouts or Whole Foods, can help guide you in the right direction for probiotics that will also help to maintain healthy urinary tract and prostate health.